name's Elizabeth Triplett, and I'm the health nurse here from Midway College, doing a presentation on Warfarin therapy. And with me I have...
Nita Triplett.
Okay.
Yuli Schaefer.
All right. And Mrs. Triplett, you are the client here today, the patient, and we're here as a referral from your health provider who has prescribed Warfarin, and at your request. And we have had an interview on the telephone prior to this occasion. We've talked about your learning needs, and Mrs. Schaefer, we've talked to you as well, haven't we?
You have.
Yes. And you've agreed, as Mrs. Triplett's daughter, to be her, the new term is called health extender. You're a resource within her own circle that she can go to if she needs additional information about her medications. So you are the extender, and we're delighted you're here. We are going to go over the aspects of your therapy. And first of all, Mrs. Triplett, you told me that you use hearing aids. Do you have your hearing aids in?
Have both of them in.
Oh, terrific, terrific. And I see you've got your reading glasses as
Yes,
well.
I do.
All right, are you both comfortable and ready to go? Terrific. Okay, what we're going to do today is go over the therapy that your doctor has prescribed for you.
Okay.
So you can have information on what you need to do with it and clear up any areas. And I know you're a retired nurse, that you worked as a nurse for 40 years, and that much of this is just stuff you already know, but we all find it helpful sometimes to go over things again. So bear with us when we're boring you with old knowledge. This drug's been around for a long time. All right, our objectives are to describe the components of the therapy with 100% accuracy at the end of the session, to be able to list 3 things that might affect your Warfarin therapy, to identify 2 sources for clarification and information, and to express the link between the compliance with the therapy and your independence. Tell me, Mrs. Triplett, what is the most important thing to you in your life now as a 79-year-old woman?
To maintain my independence, and I do dearly want to spend out the rest of my life in my own home.
I think that's a wonderful goal. What about you?
I ditto that.
Okay, all right. We all know about those.
But I've been diagnosed with this atrial fib, so I got to get a good handle on that.
Okay, absolutely. I think that there is a strong link between being compliant with your therapy and being able to maintain your independence. And you said this atrial fibrillation, or AFib as it's commonly called, is a new diagnosis for you. And the best way I've come to understand it over the years is it's a condition where your heart quivers. You've lost those strong contractions that make your heart beat fast, and those quivers make your rate go very high, but at the same time they're not sending the blood out of the heart. It pools in the bottom of the chambers there.
Somebody's teaching you well.
Well, thank you. And when you have that blood that pools, it tends to clot. Just like if you cut yourself and you just let it alone, you're going to form a clot. The same thing happens in your heart. But if a clot moves from your heart to your brain, that would be a common way for you to have stroke. If it moves to a major part of the heart and causes blockage, it could cause a major heart attack. So those are both situations that we desperately want to avoid. And Mrs. Schaefer, I know that you've got your iPad there, and I just wanted to let you know, I meant to tell you when we started this, if you want to follow along on that, you're certainly welcome to. I emailed both of you copies of this presentation.
Thank you, there it is.
Oh, good. All righty.
Yeah, I like things that work.
Okay.
Thank
Now,
you for doing that.
oh, you're most welcome. Now, talking about blood thinners, the medication that's gonna keep that blood from pooling and clotting, we're talking about warfarin. It's also called Coumadin, and people will use all of those terms interchangeably. Warfarin is the scientific name of the drug. Coumadin is a brand name. It's like the difference between acetaminophen and Tylenol, scientific brand name. But for these purposes, we'll just call it warfarin. When you get your prescriptions, it makes no difference. Coumadin and warfarin are the exact same things. Warfarin stops the blood from clotting, and it does that by eliminating vitamin K activators in the liver. A little more scientific than you probably want to know, and you may already know that. But clotting is normally controlled by vitamin K, and what this is doing is suppressing that. So, and again, therapy with warfarin can prevent clots and reduce your risk of heart attacks. Now, your dose of warfarin, and you said this is your medicine bottle, is 5 milligrams. And the thing about warfarin is that your dose is going to change as you get to a therapeutic level, and that's what makes warfarin therapy a little more complicated. But it's very important to take exactly what the doctor's ordered. And if you look in the packets that I've brought you, there's a document called the warfarin log, and that's, you know, as you can see inside, there are places for you to write down the dates of your blood test, what the results were, and what dosage you're supposed to be on. And it's also a good place to make any notes that you might have about things that come up. I took, you know, for example, I took my medicine 3 hours late on this day. Visited my son's home, and he had Brussels sprouts for dinner. I ate a large helping, you know, those sorts of things. So, and you'll note there that I wrote your last PTINR result, that's the blood test, and we'll talk a little more about that, and put your present dose.
Okay. Is this something you should keep with you at all times?
Absolutely, and that's why it's made like that. It's designed to fit in a wallet. Excellent point. So take the medicine as ordered, expect changes, keep a record, and just remember it's complicated, and the key is not to take more or less than ordered. Okay, on to our next slide. We've got some pictures here of Coumadin and warfarin pills. And the warfarins are ovals, and the Coumadins are round. And again, they're the same, you know, the very same thing. So you can take whichever one is prescribed for you. And we also have here a little guide that shows the colors of the pills. They all have a different distinct color, and they all have the number printed on those. And it is small to look at those pills. You know, as you can see, they're just about that size. And it's a good time to have a magnifying glass helpful. Unless you're just eagle eye, I find it helpful to just look at those things. And so when you're going to take your medicine, look at the color, look at the number, think about what you're supposed to take, and then take it. Do those checks and you probably won't go wrong. So let's see. What does, Mrs. Triplett, what does a 5 milligram dose of warfarin look like?
It's oval,
Okay.
kind of a tannish brown color, and it's scored.
Okay.
So if you, doctor reduces your dose to 2.5,
You can take half of a pill, great. Now what if you didn't have 5 milligrams and you had some other pills? What's a combination that you might?
hopefully it would be 2.5 per
exactly, exactly.
Now, if she has a tablet that's 10, could she have that?
She can. You know, some medicines, you brought up a good point, some medicines you're not supposed to break or, you know, chew or tear in half. This is one that you can, and that's why they've got those score marks on them, so you can just,
Grooves, you can almost do it
Yeah,
with your thumbnail.
you can.
Or get a pill splitter from the drugstore.
Exactly, or you can use a kitchen knife, you know, it's just a compounded tablet, it's not that hard to do. So, the important thing, again, is to take your medicine, and you also have to take it at the right time. The recommendations for warfarin are that you take it in the afternoon. In the hospitals, you may remember you got your dose about 5 o'clock. That's pretty consistent practice, so that it's something you may want to do here at home. And you've showed me that you have one of these
Yes, I
weekly pill managers, and I think those are great. They've got AM and PM for every day. So if you start at the beginning of the week on Sunday and lay out your pills, then you'll know, you won't have to worry about, did I remember to take that? If it's gone, you took it. So you can do that, and I know you have some other medications that you take in the morning, and you can put those there in the top. These come with as many different openings as you need. I've seen them for cancer patients that are like, they look like tackle boxes. You know, they are so big and have so many different times and places. You obviously don't need anything like that, but if you have medicines that have 3 different times during the day, you can certainly get a larger one of these. Okay, so take your medicine on time. If you miss your dose, here's what you do. If it is within 8 hours of when you take it, and you realize you haven't taken it, say you take it at 5 o'clock, and 4 hours later, you say, oh goodness, I forgot to take my pill. It's under 8 hours, so you go ahead and take it. If it's longer than 8 hours, skip it and take it at your regular time the next day. The most important thing to know in that respect is to not double up on pills. You do not want to do that if you miss a dose. If something happens that you don't get your dose for 2 or 3 days, call your doctor or your provider, whoever's, you know, in your case, your cardiologist who has prescribed this, and let them know, I've had the flu, haven't been able to keep things down, I haven't had it for 3 days, what do you want me to do? So, communicate. And
What if she misses it or takes it 8 hours after she's supposed to? Is it okay for her to take it at the next day at the regular time? Because it will only have been 16 hours between doses.
if she takes it within that 8 hours,
Okay.
she's fine, and then she'll just take her regular dose the next day. But if it's, you know, if she takes it at 5 and it's 1 o'clock in the morning, she can take it. If it's 1:01, don't take it.
But then if she takes it at 1, she can still take it again the next day at 5?
Yes, exactly, exactly. Okay.
So I wouldn't, then, I would not adjust the 5 PM time the next day.
No, take it at
Okay.
your exact same time.
Good deal.
Yeah.
All
All right.
Gotcha.
So you normally take your medicine at 5 o'clock. You wake up at 1:30 in the morning and say, oh darn, I forgot to take that Coumadin tablet. What do you do?
1 o'clock swallowed before 1:01.
Okay, so it's 1:30. It's 1:30.
Okay, 1:30, 1:30, or just wait till 5 o'clock the next day, right?
Actually, no. If it's before 1 o'clock, if it's 1 o'clock or before, you can take it. But the scenario that I'm proposing here, it's 1:30 in the morning.
Oh, 1:30 in the morning?
Yeah,
Oh,
so what would
gotcha.
you do? You would
Skip
not
it.
take it, exactly.
Okay.
Very good. Okay.
We're so proud.
But